I'm very pleased now to be joined by Dr Jeremiah Chakaya Muhwa, who is President of the Union. Welcome to you.
Thank you very much.
So this is a conference, obviously TB is a big focus, but also there are other lung diseases you're looking at. What would you say are your priorities there?
So tuberculosis, of course, remains the big one for the Union for obvious reasons. Many years ago, 100 years ago, this organization was set up primarily to confront TB, which was a global major public health threat by then. And unfortunately, 100 years down the line, tuberculosis still remains a major public health threat. The figures from the WHO that come out every year have elevated TB to be the #1 cause of death from a single infectious agent. So it still remains a big problem for us. But the Union is also aware that there are other problems that afflict humankind in the lung: asthma, COPD, and diseases that are related to air pollution, especially pneumonia in children. And those are also a focus of the Union, and they are getting space within this Union conference this year.
And how are we doing on air pollution? Are we improving things? Is it getting worse?
In general, I think things are getting worse, to be honest, especially in low and middle income countries. As we industrialize and we do not put into place good regulations or enforce good regulations for air quality, we are seeing cities in low and middle income countries that are becoming extremely polluted. At the same time, we are still seeing continuation of use of biofuels in many homes in low and middle income countries with very high levels, therefore, of indoor air pollution. And at this moment in time, the effort that is being done by agencies like, including our own agency, the Union, are not as robust enough to confront that problem. The future is promising, but at this moment in time, we are not doing as much as we should be doing at the global level, almost everybody.
And you're reminding people that we have to think of TB not in isolation, but as with some of the other comorbidities, the diabetes, HIV. Why is that difficult to treat them all together?
I think over the years, health programs have a tendency to develop in silos, as it were. So you have the TB silo, you have the diabetes silo, you have the asthma silo, you have the COPD silo, and on and on and on, and it goes on. But at the end of the day, what you want to look at is the health of individuals and populations. And health of individuals and populations can sometimes be very complex. Your TB patient may be the same fellow with HIV, as often happens in sub-Saharan Africa and also in other parts of the world. Your TB patient could easily be a chronic smoker and therefore has COPD. Your TB patient could easily have multiple other problems. And therefore, integrated care really at the end of the day is what is critical. And I think we should be looking at individuals in a holistic manner as we provide our TB care.
This is it. Well, thank you so much for telling us all about it.
Thank you very much, too.